time you were before Congress, Secretary Kennedy, you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary Kennedy. Let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
You know, I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines.
We now have Senator Smith. You're recognized.
Thank you, Mr. Chair. So, Mr. Kennedy, I have sat here for the last many minutes and listened carefully to your testimony. And I think actually Senator Tillis laid out so many of the ways that what you have said has contradicted yourself and others. It's, I mean, I don't even know where to start. So I'm going to start here. Over the last 8 months, you have claimed to make America healthy again. But in actual fact, you have led the charge in the Trump administration to destroy what is best in our healthcare system. And your denials and your evasion and your lies here do not change that. You are the Secretary of the Health and Human Services, yet you're trafficking in these fringe idea and discredited theories that are completely out of step with the scientific consensus, and you seem to be willing to say anything in the moment, even if it's untrue. So last time you were before Congress, Secretary Kennedy, you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary Kennedy. So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth. I mean, here's what I know. Here's what I know.
You want me to explain why, Senator? Or you just want to...
Actually, I want you to listen to me.
Okay, go ahead.
I want you to listen to me, because I've been listening to you. You said that ACIP is an independent panel after you stocked it with your picks. You said that you want evidence-based science, but it seems that what you mean is evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world. It's incredible. But let me move on. Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
You know, this is what you say, right, Secretary Kennedy? When someone presents you with information that does not fit...
I did not blame that shooting. I have no idea whether... I have no idea, and I never said that. You're making it up. You're twisting. Yeah, you are.
Secretary
you are being
Kennedy,
dishonest right now.
If you want to talk about mental health and gun violence in this country, if you want to talk about mental health and gun violence in this country, we should be talking about that, because that's what the parents of Annunciation School...
You don't want to talk. You want to harangue, and you want to politically, you want to have partisan politics. I want to actually solve these problems.
Secretary Kennedy, what the Trump administration is doing right now is making it harder for people in this country to get access to mental health care. So don't talk to me about solving the mental health care crisis when you are making it harder. You cut Medicaid, which is the #1 payer for mental health care services in this country. You decimated the agency at Health and Human Services that focuses on mental health and substance abuse. That's what states count on. They're cutting their services to schools as a result of that. Several years ago, in a bipartisan way, Congress came together and passed the Safer Communities Act, which made important investments in mental health care and did some important, though small things, to reduce access to guns. What do? You propose cutting that funding. This is what we're talking about in your leadership in the Department of Health and Human Services. If you want radical transparency, as you talk about, I mean, take a look at what you are doing. And, you know, I've heard a lot about MAHA today while we've been here. There's a lot of Americans, Secretary Kennedy, who trust you, who believe what you say, especially when you say you're standing up to corruption. And I think that they need to know, you apparently have a lot of influence with President Trump. Did you ask him not to roll back these regulations that are stopping the big corporations from dumping heavy metals and endocrine disruptors into our soil and water? I mean, there's no evidence that you have been even opposing that. Did you do anything to stop the Trump administration from rolling back this handout to big pharma that makes it easier for the big drug companies to charge more for cancer drugs? No, you presided over that. I mean, it's stunning, really, what's happened over the last 8 months. It's stunning to me. And I just hope that in this moment, our colleagues, there's hardly anybody left in this room, are going to think about what it is that you've done, what your legacy is going to be at the Health and Human Services Agency, and pay attention to the damage that is being done here.
Senator Marshall.
All right. Thank you, Chairman, and welcome, Mr. Secretary. One of your themes for the CDC is transparency. And I think when I hear you talk about transparency, I think part of that is sharing what you know, what the CDC knows with parents so that they can make decisions. Behind me, yeah, I know it's going to be hard to see from there. I can barely read it. This is the current CDC recommendations for vaccines for children. On day number 1, they get their first jab, a hepatitis vaccine. By the time they're 18 months, they've had 18 jabs. By the time they get to be able to vote, they have 76 jabs. Now, when I listen, what I hear you say is that, look, vaccines are drugs. We need a measured response and a measured, when do we use this? It's interesting that the United States has put age 65 and older for COVID vaccine. UK has chosen 75 and France 80. Obviously, scientists disagree exactly when that should or shouldn't be. Hepatitis B vaccine, it makes no sense to me. I've only delivered 5,000 babies, but we do a hepatitis test on every mom. By the time she delivers that baby, I know her pretty well. And if she doesn't have any risk factors, if she's not an IV drug abuser, if she's in a stable monogamous relationship, nobody at home has hepatitis, I don't know, I don't see the benefit myself in that hepatitis vaccine. Everyone's eligible for it, everyone can get it, and my pediatricians always agree with me. And no, I'm not saying if you don't know the hepatitis status of that patient, they shouldn't get it. I'm not saying if this person's had no prenatal care, that puts them at risk for hepatitis. Can you just speak a little bit, when you talk about transparency, and trying to empower and make vaccines available, these should be treated just like a medication.
Yeah, I mean, you know, I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines. And we don't understand the risk profile because vaccines are the only medical intervention, medical device, or pharmaceutical drug that are exempt from pre-licensing safety studies. And so there are 2 hepatitis vaccines, and one of them had a safety study that lasted for 4 days on 143 kids for a product that's going to be given to 76 million kids. Yeah. The risk profile prior to the introduction of the vaccine, the risk of a baby dying from hepatitis B was 1 in 7 million. That means you need to give 7 million hepatitis B vaccines to prevent 1 death if you're going to give 7 million.
Right. So, Mr. Secretary, and I guess before the press labels me wrong, I'm not anti-vaccine either. I think MMR has been a great vaccine. The DPT's been a great vaccine. Polio's been a great vaccine. Smallpox. So there are great, but it's the measured approach that we're after, the transparency. You're trying to empower parents here. What I feel the difference is, sometimes my friends across the aisle feel like there's a one-size-fits-all, that they should be telling parents what to do. And what you and I are fighting for is we want to empower parents to make these decisions. I want to talk about morbidity and mortality of COVID for just a second. It is so true that 2 things can be true, and I don't understand why, just the rabbit hole some of my colleagues are going down. There's a big difference. When I was out there practicing, doing volunteer work, I was so confused myself on the numbers, people dying with COVID versus from COVID. And we still don't have that message, and I think that's what I hear you saying as well. How many people died from COVID versus with COVID is a different answer. The situation today is so different when this monster virus was made in a laboratory in Wuhan, China, and none of us had ever seen this virus, and we had no immunity to it. But today, every American's had COVID a dozen times probably, and we built up immunity. And I think that's why that both things are true. It was a miracle. Warp speed was a miracle, what President Trump and his team did, and it saved millions of lives most likely. But it's also true that it probably killed some people. Like most vaccines do, there is a death rate associated. So both things are true. Anything else you want to clear up on the morbidity, mortality of COVID and COVID vaccines?
Well, I think you just cleared it up. The COVID vaccine was critical. President Trump's leadership got it to us when our society was locked down. It allowed us to open up. It was, as I said, perfectly matched to a virus that was new in the experience of humanity. And so it was a miracle. Right now, we're dealing with completely different circumstances where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different, and it's complicated. And, if you just want to turn everything into a soundbite, it makes it, you can't have a grown-up conversation. But, there were more reports to VAERS, which is the only surveillance system that we have, of injuries and deaths from that vaccine that all vaccines put together in history. So we have to acknowledge that there was a cause. We acknowledge that there was a benefit. We can't quantify either one because of the data chaos at CDC, and that's all I'm saying. And they think I'm being evasive because I won't make a kind of a statement that's almost religious in nature. Did it save 1 million lives? Well, there's no data to support that. Or maybe data, there's no study, there's modeling studies, there's faulty data. I'm not going to sign on to something if I can't do it to a scientific certainty. It doesn't mean that I'm, anti-vax. It just means I'm pro-science.